Genetic testing means growing an embryo up to 5th day of life in the lab and then taking a few cells, and these cells are subjected to chromosome analysis, and we can get to know the chromosome number is normal or abnormal in the embryo. So who needs embryo testing? In general, it is a rule of nature that all embryos are never normal. For any person, be it young or old, some embryos are bound to be abnormal and some embryos are normal. And the proportion of abnormal embryos increase with age. So a person who is above 40 years of age, it is mandatory that they check the embryos for chromosome normalcy before we transfer it back to the womb of the mother. It is ideal to check it starting from 35 years and mandatory to check it beyond 40 years. Also, there are some instances where a woman has tried IVF many times and had transferred embryos to the womb, but it has never been accepted by the womb. So repeated IVF failures is also an indication to check the embryos for chromosome analysis. Another indication would be a couple who have had 3 or more miscarriages in the past. Miscarriages happening within 3 months of pregnancy are often due to chromosomally aneuploid or abnormal embryos. So it is wise that we check the embryos are having a normal chromosome number or not before we place them back to the womb of the mother, so that we can prevent the trauma of going through another miscarriage. So when we have the report of chromosomally normal embryos, does that mean that these embryos will 100% implant? The answer is no. Unfortunately, the science and technology today can only find out chromosome number defects. It cannot find out the genetic defects within the chromosomes in all the embryos. Yes, if we have a clinical condition that we know in the parent, we can specifically check for that clinical condition in the embryo. But we cannot globally check for all the permutations and combination of abnormalities in every embryo. So that means that each embryo which is tested to be chromosomally normal in the number will still have a chance of implantation of about 50%.